A pleasant day, ma'am and classmates. So we are the last group of reporter for the CHN. So our group members are Miss Hanan Arane, Mr. John Ryan, Christian Aranco, and yours truly, Miss Nursima Ayandan. So to start with, oral health program. So I'll be introducing to you this topic. In terms of decade missing filled teeth or the DMFT index, Philippines ranked second worst among 21 World Health Organization Western Pacific countries. It is more prevalent in rural than urban areas, which means it is more common sa mga outside the city or mga provinces than sa mga city or town. Mas common jud ang tooth decay or kanang pagkabulok sa ngipon sa mga province or baryo nga gawas sa city, no, kay main reason ani kay tungod sa poor access sa dental care, tungod sa kakulangan og dentist, pati clinic, and also dili ka afford ang ubang tawo maong ginapasagdaan na lang nila usahay bisan sakit na bitaw or daghan nagbulok sa ngipon. The Philippine Dental Association survey resulted nga 88.4% sa mga patients sa dentist kay gikan sa urban areas and 0.7 lang ang sa rural areas. Wherein dinhi pa lang is makita na nato ang big difference nga daghan jud ang need og dental care or attention gikan sa rural area or outside the city, which are the province and barrios. With this, the delivery of the basic oral health care became the responsibility of the local government. Ang oral health hindi na sapat na isama sa pabansang sistema ng bansa. And there's no currently basic oral care service being adapted, with which I find disappointing. Biskan bitaw na responsibility na siya sa local government is wala gihapon siya na napasama sa national system sa ato ang country. Even though nga taas na bitaw ang cases sa tooth decay is wala ra kaayo siya na hatagan or gihimuan og national care system nga maka-focus aning problem. But hopefully, as we go farther and in the future, nga naanay mahimo and ma-appoint ang government para ani. So to go farther with this topic, we'll be having Mr. Aranco to report the following.
Good day, ma'am. My name is John Christian Aranco, and this is my report. So, oral health program. In the Philippines, the main oral health problems are dental caries, tooth decay, and periodontal disease or gum disease. In terms of decade, missing filled teeth, DMFT index, the Philippines ranks second worst among 21 Western Pacific countries. Oral health problems are more prevalent in rural areas than in urban areas. So in the Philippines, ang main oral health problems are kanang daot ng ngipon or periodontal disease, kanang gum disease, like gingivitis, kanang maghubag ang gums. In terms of decade, so oral health problems are more prevalent in rural areas and urban areas. Possibly ang mga sa rural regions kay they have less access to mga pang dental hygiene or even healthcare para sa oral health nila. The Local Health Government Code of 1991 made the delivery of basic oral health care to the responsibility of local health government. However, our oral health is inadequately integrated into the national healthcare system. There is no currently sustainable basic oral care service being adopted. So ang Local Health Government Code of 1991 kay gihimo nila para ang basic oral health care kay responsibility sa local government. However, ang local government wala sila dili maayo ilang pag-integrate ang pag-deliver sa oral health care. So walay sustainable na basic oral health service na gina-adopt. So goal to reduce the prevalence rate of dental caries and periodontal disease from 92% in 1998 to 85%, and from 78% in 1998 to 68% by the end of 2010 among general population. Objectives: to increase the proportion of orally fit children under 6 years old to 80% by 2010. To control oral health risks among young people. To improve the oral health conditions of pregnant women by 20% and older persons by 10% every year until 2010. So basically, ang goal nila kay ilas ang pag-occur sa dental caries and periodontal disease sa mga tao. So the stages of life, this is the unsa ilang need na type of oral service on their stages of life sa mga tao. So ang pregnant mother, required nila oral examination or prophylaxis, permanent fillings, gum treatment, and health education. Neonatal and infants under 1 year old, dental checkup as soon as first tooth erupts, health instruction on infant oral health care, and advice on exclusive breastfeeding. Children 12 to 71 months old, dental checkup as soon as first tooth appears and every 6 months thereafter. Supervised toothbrushing drills, oral urgent treatment, removal of unsavable teeth, referral of complicated cases, treatment of post-extraction complications, application of atraumatic restorative treatment. So, kanang sa mother, importante ng oral health nila. Kay nawe mga uban mother na dudon sa toothpaste, sa lasa sa toothpaste or sa texture sa breath, sa brush sa ilang mouth. So dapat mag oral examination jud og i-educate sa sila. So ang neonatal kay as soon as the first tooth erupts, kung una paggawa sa tooth sa ngipon nila, kung magngipon na, ipa-check up dayon ipa-dental check up dayon. Same din sa children 12 to 71 months old. First tooth erupts, ipa-dentist jud, ipa-check up jud, and every 6 months thereafter. So supervised toothbrushing drills, so i-supervise pa jud nimo kay mga children pasin kapuyan sila mag toothbrush or something, dili sila kabalo. So you have to teach them how to properly do it, supervise them how they do it. Kung mga unsavable teeth, so kung nataan na kung mga baby tooth, it naturally falls out. So school children 6 to 12 years, oral examination, supervised toothbrushing drills, topical fluoride therapy, pits and fissures, sealant application, oral prophylaxis, permanent fillings. So na i maragapon dental examination, oral examination, pa-check up. I-supervise ang toothbrush, and some mga interventions para pang cure or pang prevent sa mga oral health problems. Adolescent and youth or examination, proper health promotion and education, adverse effect of consumption of sweets, sugar beverages, tobacco and alcohol. So kanang mga ingana na edad, adolescent and youth, so they need to be educated kay sa mga ingana na years dili makontrol sa parents kung sa ma-consume sa bata. They could probably start drinking sugary beverages like mga Coke, or eating too much sweets sa school, or even they could start tobacco and alcohol, which has a lot of health problems, can cause a lot of health problems, including oral health problems. Older adults, 25 to 59 years old. Oral examination, emergency dental treatment, health instruction and advice, and referrals. Older persons, oral examination, extraction of savable tooth, gum treatment, relief of pain, health education, health instruction and advice. So, mga nga na age, so older adults, so routine check-up kung mahitabo sa lang ngipon, emergency dental treatment, and health instruction and advice kung magka-problema sila or they have bad habits or gana. Older persons kay kawalan ta mga tinggo lang over time, madaot siya ng ngipon, and to the point na i-extract siya ng unsavable tooth. So gum treatment, relief of pain, so classification of oral interventions. Preventative measures promote oral health and protect against dental caries and other oral disease, including oral examination, oral hygiene, Pitt and Fisher sealant program, and fluoride therapy. Basically, ang preventive kay any oral health na interventions na maka-prevent sa mga oral health problems. So, curative. So, the curative or treatment services are remedial measures applied to halt the progress of oral disease and restore the sound condition of the teeth and supporting tissues. This includes permanent filling, gum treatment, atraumatic restorative treatment, temporary filling, and extraction. So, mga curative, if interventions na which actively cures or kanang treatment sa oral health problems. So, promotive services. The promotional services include health education activities that are directed to priority groups. These activities can be carried out using an individual or group approach, and with the help of accepted tools and media. So, health education activities directed to groups. Oh, kana mga promotive mga promotion sa oral health. Essential packages of health services that a newborn, infant, and child has to receive during their early stages of development to be protected from the common preventable disease and other conditions. So, mao ni ang mga health services na kailangan sa newborn, infant, and child. So, 1. Newborn resuscitation, newborn routine eye prophylaxis, prevention and management of hypothermia of a newborn screening and immediate exclusive breastfeeding, complementary feeding at 6 months, birth registration, birth weight and growth monitoring, full immunization, micronutrient supplementation, dental care, development milestone, advice on psychosocial stimulation, growth monitoring and promotion, nutritional screening, micronutrient supplementation, disability detection, management of common childhood illnesses, counseling on accident prevention, on the use of safe toys, psychosocial stimulation, and first aid. So, ano yung mga health services na kailangan nila sa mga newborn, infant, and child. So, that ends my report, ma'am. Thank you.
Okay, so good day. So my topic is about the adolescent health program. So for the introduction, adolescence is defined by WHO or WHO as the period of life between 10 and 20 years old of age, while the youth refer to those who are between 15 and 24 years old. The term young people refer to both age group, meaning those aged 10 to 24 years old. So young people account for a little over 30% of the total Philippine population, around 26 million. Young people have developed a physiological resistance against common acute infection and are at peak of their health. Mortality from all causes for this age group is 0.87 per 100,000. Okay, so when we say physiological, this is the characteristic of healthy or normal functioning of the body. So kanang process nga mo occur inside sa atong mga kinalawasan. Ang example sa mga common acute infection is isa na ang cold or flu, dayon and apil na pud ana ang stomach flu or kanang mga fever, apil po na siya. Okay, so among adolescents nga nag-edad 19, 12% sa mga young people kanang sa ilaha is sexually active. So apil ta ani nga age. So kita is inganing idara is very active na ta for sexually active, for sexuality. And by the age of 24, 45% sa mga babayi is already mother na. Dayon women nga nag-age og 15 to 24 years old, is sila ang mga group nga highest kayo ang rate na wala bitaw na meet ang family planning about ang rate ni is about 26%. So if that's why nga importante kayo ang health program for adolescents para sad mahatagan sila knowledge o information about ani. So nga namang if unmeet ang family planning daghan kay adolescents nga na magkapamilya dayon Dayon, if ing ana dili pa stable ang ilahang life, right? Dili pa stable ang ilahang life. Unsa may mahitabo nila? Kung daw sila eskwela kay mangita na lang trabaho. Dayon, ma-increase noon ang poverty. Ug ing ana. No, dayon at dayon ang smoking pod no sa ingani nga idara is daghan na kay mo engage og mga smoking, mag-inom-inom dayon naa na po'y mo take og random drugs kanang mga abusive drugs. So that's why ang health program is very important para pod no empowered ang mga adolescents people, matagan sila information about ani. That kay usahay man gud mahimo nila ni is out of curiosity nila. So no, that's why daghan kayo mga teenage pregnancy karon nga generation. Kay kulang man gud sila og information, kulang sila knowledge ana. So no, ang kalindot pod sa health program is ma-educate jud nimo ang mga adolescents. No, like matabangan na to sila to be empowered and ang communities is mag-live sila happier. So by improving ang ilahang physical, mental, emotional and social health. Social health through increasing their knowledge and influencing their attitude on caring for their well-being. Then, in 2000, accident and injuries are most common cause of death among young people at the rate of 30.68 per thousand person aged 10 to 24 years old. About 22.52% among all those people who died of accident and injuries of all form are adolescents and youth. Okay, so now we have the strategic trust for 2005 to 2010 are. So first, came up with the model of adolescent-friendly health service and adolescents-friendly environment. So no kani is when we say adolescents-friendly environment. So no dinha nga part is gina-address ang mga possible barriers o mga obstacle nga ma-face sa mga nagbibinata o nagdadalaga na. For example, naiisa ka binata, no? Usahay okay, wala man siya knowledge about sa iyahang na-feel. Katong nakakita siya, for example, kanang naked body. Sa isa ka bayi, then curious siya sa unsa to, pero walay. So, sa isa ka bayi, then curious siya sa kanang unsa to, pero walay makatudlo niya. Mauni ang uses sa youth-friendly service health, wherein naka-access ang tanang youth and adolescents sa high-quality sexual reproductive health service. Kana bitang dili maulaw ang isa ka bata nga mangutan na siya kung unsa to, dayon mo-comfortable siya kay walay mo judge niya kung naa siya mga pangutana. That's why a friendly environment. Kung naa siya ma-curious na isa ka bagay is tubagon jud siya ayo sa dito nga environment nga walay judgment. So next is organize and build the capability of young people to promote healthy lifestyle including sound reproductive health, practice accident prevention, and the promotion of sound policies on work to improve their health and quality of life. And the next sa strategic is kaning continue fertility awareness activities among high school teachers and students to reduce the proportion of unwanted pregnancy and unmet need for family planning among young people. And the next is we have the essential healthcare package for adolescents and youth. So first is we have the management of illness. By managing the illness is ma-improve ang quality life sa isa ka person, ma-prevent or ma-minimize ang effect sa ilahang illness through managing, through sa pag-care sa ilahang self. Then ma-maintain nila ang ilang healthy lifestyle. So that's why management of illness is important para bitaw dili magka-worsen ang isa ka illness sa isa ka tao. So next is the counseling on substance abuse, sexuality and counseling on substance abuse, sexuality and reproductive tract infection. Okay, so counseling on substance abuse. So for example, diba daghan kay adolescent karon ga-engage og ng substance abuse. Example ana is drugs, and kasagara jud is kanang rugby. So need nato na sila i-counsel para bitaw maundangan nila og kanang dili sila mo engage ana kay namang ubang mga bata is wala sila counseling on substance is very important. Kay dagan kay mga adolescents ron nga nag-engage og abusive of substances. For example, is kanang drugs and og kanang kasagara jud is marugby, kay ang rugby manggod is mura lang jud na siya. So usahay manggod ginahimo ni nila kay kulang silang knowledge ug information about ani paunsa ni makaguba sa ilahang individual self. That's why kaingon ko ganina nga health program is very important para makagain og knowledge ang mga adolescents sa mga dili ka maayuhan nga hitabo. For sexuality na pod is okay, so for sexuality is importante kay ni nga mahibal-an sa mga teenager kay usahay manggod na ay mga adolescents ron nga nalibog sila kung unsa ilahang sexuality og usahay kay malibog sila sa ilahang behavior sa ila kay nga na-feel niya nga bayi sila ayun na apoy bayi nga feel nila lucky sila. So that's why counseling is very important about ani. Ug ang kanang reproductive tract infection is very important pag nga mahibal-an nila kay para bitaw malayo sila sa ingani nga mga infection ug kung asa ni siya makuha. And then next is ang nutrition and diet counseling. So importante sad ang nutrition and diet counseling for adolescents para makahibalo sila unsaon nila pag-maintain sa healthy lifestyle og pag-minimize sa ilahang mga weight og ma-reduce ang illness risk. Og ma-ensure sad ang ilahang proper development and growth. Kay ingani nga stage man gud ang mga bata kanang kaon ng og kaon, inom lagong inom, wala na dili sila kabalo unsa joy healthy lifestyle. So that's why need ni nga health educate sa ilaha. So ingnon nimo unsay bawal, unsay need nila kanon. So kay ang pagkaon manggod og healthy but in moderate lang og mo engage in regular exercise maka-help ni sa ilaha nga maka-avoid sila weight gain o kanang iron deficiency, anemia o kanang poor bone mineralization. Amigo. Okay, so ang next is ang mental health. So ang bata is need na siya good mental health para ma-develop kay siya ayo og ma-build ang iyahang strong relationship o maka-adapt siya changes, and ma-adapt niya, dali niya ang changes sa iyahang life o sa kanang mga challenges sa iyahang kinabuhi. So ang mga teenager nga naay good mental health, often maka-feel din na sila happier and more positive about themselves and ma-enjoy jud nila ang ilahang kinabuhi. O ang isa ka person pod is dili healthy ang iyahang mental health is maka-impact jud na siya, maimpakan jud na kung bisag asyan siya na areas sa iyahang pagka teen life. So no, ang youth nga with poor mental health is na possibility sa iyahang mag-struggle siya sa iyahang about school, grades, decision making, and also sa iyahang health. So no, naana dira tong ma-depress ang isa ka bata, maka-feel siya anxiety. So no, which can lead to illness o kanang mga diseases, and mas nalimpaan na is ang suicidal. So that's why mental health is very important. Good mental health is very important sa isa ka adolescents. Family planning and responsible sexual behavior. So no, family planning sa inganing idara is very important og ang responsible sa iyang sexual behavior kay inganing idara, di ba, tunghingan ako ganina is very sexually active na. So that's why nga daghan nag teenage pregnancy og kanang ang family planning pod is kana bitang makalikay siya mga reproductive tract infection, for example kanang STI. So no, imuha jud na silang i-health educate unsa nang family planning ug kanang sexual behavior. And so for dental care is importante ni siya nga ma-health educate sa isa ka adolescents para ma-prevent ang decay, ang tooth decay and gum disease kay no, kay sa inghaning idara bisag unsa na ikanon sa mga adolescents. So next is the adult man. So the number of Filipino males aged 25 to 53 years old is 16 million, or about 19% of the total population. Of the total number, about 38% of them are males. Among the adult men aged 25 to 59 have naana sila poor health status, and with the highest level of health risk behavior and the lowest use of health service compared to other health risk compared to other group. However, a year 2000 statistics show that it accounted for about 22% of total death and 68% of total death for group age 25 to 59 years old, or more than double the number of deaths among women in the same age group. Okay, so no, naay mga disease nga primary male concern nga mo-occur. For example, kaning benign prostatic hyperplasia and prostatic malignancy. So ang death rate for this disease are still low among male nga nag-edad na og 25 to 59 at 0.72 per 100,000 for prostatic malignancy and 0.06 per 100,000 for prostatic hyperplasia. These are increasing in incidence as the male grows older and can be detected through regular digital rectal examination among the male population. So no, naa po yung mga cases, that's why magka-cause sa death sa isa ka male, apil po ang alcohol among the male population. So no, when it comes to death, no, mas daghan jud nga laki ang mamatay kaysa bayi. Kay ang isa sa reason is sa ilahang lifestyle or mga habits. So no, ang mga laki pod is mas dagko ang rate nga nangamatay sila nagaka-cause kanang bitang accident o injuries than sa mga babayi. So no kato akong giingan ganina is because sa ilahang habit, sa ilang ginahimuan o sa ilahang mga lifestyle. So, ang essential healthcare package for adult male and female. So, again, we have the management of illness, counseling on substance abuse, sexuality and reproductive tract infection, nutrition and diet counseling, mental health, family planning, and responsible sexual behavior. And next is ang dental care. Then next is ang screening and management of lifestyle related to other degenerated disease. Example anang degenerated disease is, for example, is kanang osteoporosis o ang Alzheimer disease. Ang anong need man og screening and management. So, need ni siya para dili ma-care ang isa ka person og dili ma-prevent og ma-minimize kung unsa man ang disease nga naa sa isa ka tawo. Next is for the adult woman. So, cardiovascular disease are leading cause of death among adult Filipino women in the 1,000 with a rate of 85.67 per 100,000 followed by malignant neoplasm. So, kaning malignant neoplasm is cancerous tumor ni siya. So, no, with a rate of 54.62 per 100,000. So, ang mga causes jud nga nag-lead sa death among female are ang mga degenerative and lifestyle related in nature. So, no, for example, is kaning cardiovascular diseases for nature. And ang TB and pneumonia are the only infectious disease included in the leading causes of mortality among Filipino female. So, goiter is a high among females, hypothyroidism, endocrine and other metabolic disorder reported that 55.62% of those who died of the said diseases are females. So no, there are many lifestyle nga related and degenerative disease is very common siya for females, such as ang malignancy of the reproductive tract and the breast. So ang kaning disease is nagka-cause siya significant number of death among women in 2000. So na ang malignant neoplasm pod kani ang second leading cause death among adult Filipino females. So kaning this disease when caught at the early stage can greatly improve the treatment outcome and survival of the patient. So among adult female aged 25 to 59, it is the breast cancer which has a death rate of 13.64 per 100,000. So the essential component of health care package for adult men and women is similar to health service provided to women, except maybe for gender-specific service related to the reproductive system. These need to be evidence-based, taking into consideration the complex healthcare system, a network that can be linked with other health supportive sector. Education, mass media can be linked with other health supportive sector. Education, mass media, labor group, and Inc. These services must be provided to ensure optimum health and prevent mortality and morbidity among adult men per woman in the general population. And the next is ang older person. So, population aging is demographic phenomenon indicated by steady increase in the number and proportion of the elderly and corresponding decline in the proportion of younger age group. This due to increase in life expectancy, mortality reduction, and fertility reduction that are brought about by advances in medical technology and medical care as well as by improved socio-economic condition. So, ang elderly population is nagsuffer dun na silang double burden of degenerative and communicable disease. Nag-cause ni siya because ilahang natural aging process. Also include ang aging sa ilahang body immune system. Sana if matanda na ang isa ka person is normal ra na sa iyahang mukuan muhinay ang iyahang immune system. That's why nga prone kay sila mga communicable disease. So no, ang leading cause sa ilahang mortality sa for this age group are ang non-communicable or degenerative disease, diseases of the heart, disease of the vascular system, and cancer. So the leading cause of morbidity are infection in nature such as influenza, pneumonia, and TB. Other common health-related problem among older person are kanang maglisod sila lakaw o maglisod sila usap sa ilahang mga pagkaon o kanang dili na kay sila kadungog o dili na pud kayo sila makakita. Dayon apil pud ang health-related problem ang osteoporosis, kanang ma-weakened na ang ilahang bone, ang arthritis, and incontinence. So disabilities and impairment in function increase with age and adversely affect the quality of life of older person. The 10 leading causes for all ages, significantly most of these are COPD. Fall on older person at 70% among all age group. So kaning disease is nag-show siya greater percentage sa mga elderly population nga mamatay. So example aning COPD is cardiovascular, ang pneumonia, ang peptic ulcer, and other gastrointestinal disorder, ug ang diabetes mellitus, and also ang TB. So the percentage of the elderly population dying of malignancy, kidney diseases, and septicemia are also significant. However, the mortality rate for accident is only 1/10 than for all age group. So ang goal sa diri nga part is ma-reduce ang morbidity and mortality sa mga older person ug ma-improve ang ilahang quality of life. So ang essential healthcare package for the older person is first is a management of illness. So need jud i-manage ang ilahang illness so para dili magka-worsen ang situation. So para pud maka-provide kag ug maka-improve pud ang ilahang quality of life. Then counseling on substance abuse, sexuality, and reproductive rights and infection. So naaman po yung mga older person nga still mo use of substances. Diyos og ang mga older is active man pud sila og sexuality. Then, ilahang nutrition and diet counseling. So, no, importante po gaya sa ilaha ang nutrition and diet counseling kay, diba, naana sila sakit. So, para mahibalan nila unsay pwede nila kanon og unsay dili nila pwede kanon og para po ma-improve ang ilahang healthy lifestyle. Then, ang ilahang mental health, like and family planning and responsible sexual behavior, ang dental care, the next is screening and management of lifestyle-related and other degenerative disease. The screening and management of chronic debilitating and infections disease. So, na importante jud kayo ang screening sa ilahang idara og management of lifestyle. So, no, para po ma-prevent o ma-minimize ang ilahang mga illnesses. The next is ang post-productive care. So, no, ang post-productive care is importante po kayo sa ilaha para po ma-maintain ang ilahang productive life ug ma-ensure ang safety sa ilahang source of income. So, ano isa sa mga example ning post-productive care is kanang exercise food sila, mag-walking, mag-walking dayon kanang ipa-engage sila social activity dayon i-motivate sila or i-positive sila about aging kay usahay na amang mga older person nga ma-worry sila about aging dayon ma-worry sila about death then no so no, that's why it is very important ang health program o ang health education para ma-promote ang healthy lifestyle sa isa ka tawo ug ma-raises ang awareness about paunsa ba or kanang about sa importance of health. Okay, so that would be all for my topic.
Now, let's proceed to the Philippine reproductive health. So, the Philippines is one of the most signatory country to the International Conference Plan of the Reproductive Health in Cairo in 1994. So, to support the effective implementation of the program, the DOH issued a AO1AS 1998 establishing the Philippine Reproductive Health, which defined the RH service package consisting of 10 elements that include family planning. In order to strengthen this, an Act of 43S 1999 was issued, adopting a reproductive health policy to integrate RH services in all health facilities as part of basic package of health services and thus ensuring a more efficient and effective referral system from primary to tertiary public and private facilities. So that as the DOH issued the 1998 Act, dili pa siya kulang pa ang support. Thus, nag-release sila og bagong act sa 1999 which nga nagpakusog ug nagpa-strengthen sa mga health services nga pwede i-avail sa in terms of reproductive health sa mga tawo. In 2004, harmonization and integration of the various approaches and different efforts in relation to women's health and reproductive health, it came up with integrated reproductive health and women's health framework with an overall goal of achieving better quality life among Filipinos. So, sa 2004, nabuhatan panibagong law ang reproductive health all about kanang mag-focus sa women's health since mas labaw man good dagko ang kailangan sa mga woman in terms sa pag-avail sa mga services about reproductive health, since they are the one who kanang naggapanganak sa mga babies, which is need matutukan ilang reproductive health. So the better quality life among Filipinos have its four main objectives. Those are reducing maternal mortality rate, which is para mabawasan ang kanang kadaghan sa pagkamatay sa panganganak. The second one is reducing child mortality, para maless ang pagkamatay sa bata. Then, third one is halting and reversing spread of HIV/AIDS, since pinaka-common ni siya is kuan ni siya sa mga sa main objective nila. And the last one is increasing access to reproductive health information and services. Easy access about sa reproductive health info and services nga pwede duulan if ever magka-problem. That's why mas gipadaghan nila ang program about ani para dili malisdan ang mga tao, labi na ang katumang wala kay mga knowledge about aning reproductive health. So, ang kaning reproductive health, naani siya 10 elements nga very crucial sa atong reproductive health, which are very familiar na kay na-encounter na ni nato mostly sa atong maternal subject, which was reported also by me. So, the first one is the first on the list is the family planning, which is the foremost intervention in attaining reproductive health. It allows couple to freely decide on the number and proper spacing of birth. So it is one of the 10 elements selected as a response to the needs of men and women of reproductive age. So it allows the couple to freely decide on the number and proper spacing. Isa ni siya sa mga one of the natural contraception para maless ang mortality o morbidity rate. So, isa ni siya sa mga natural nga pwede himuon without using chemical. Pagplanuhan lang sa both couple and matuluan lang sila og proper knowledge paunsa sila magsugod aning family planning is pwede na nila makontrol ang kanang pagpanganak, and also para pod ma-maintain nila ang health sa ilang reproductive health. So the next one on the list is the maternal and child health and nutrition. Family planning is one of the pillar of the Safe Motherhood program. The goal of attaining the optimum maternal and health child and nutrition can be achieved through the use of safe and effective family planning methods. Proper birth spacing of 3 to 5 years will give the mother ample time to regain the health and to render proper care to her newborn and the older child. So, para ma-achieve ni natong kaning maternal and child health and nutrition is need sa mother nga muyos og safe and effective family planning. Dili dapat magdali like bag-o ra ka nanganak, then nagplano na pud mo nga nagplano na pud ka as a mother nga maburus dayon next time, diba? You should consider your own health, and kay since fresh wound pa man na labi na imuhang sa imuhang private part as a woman, dagbag-o pa ka nanganak, so wala pa kay to nag-heal, so you should consider that. And also how it can affect your newborn child, diba? If manganak ka or magpaburus kag bag-o, then baby pa imuhang newborn, mawala na to imuhang time, makulangan na og pag-care sa newborn, so basing mapasagdaan nimo iyahang health. That's why dili need jud nga na ay birth spacing ang kanang isa nga new nga panganak nga mother. So that's why nga recommended ang birth spacing, which is hatagan nimo years gap imong pagpanganak para maka-recover ang body nimo as a mommy and maprovidean og needed care si baby. The next on the list is the prevention and management of reproductive tract infections, including sexually transmitted infections or STIs and HIV or AIDS. So family planning is the central focus to prevent reproductive tract infections, especially on sexually transmitted disease and HIV/AIDS. Risk assessment of especially on sexual transmitted disease and HIV is we need the FP method. So part ra gihapon ni siya sa family planning wherein FP ang central or family planning ang central focus ani to prevent these reproductive tract infections like the HIV and AIDS, which is pinaka-common labi na sa mga couple nga active ang sexual activities. So dinhi na mosulod ang health education gikan sa family planning wherein itudlo ang mga protection nga pwede gamiton if ever makipag-sexual activity ang isa ka tawo or ka couple. Dinara ang pag-use sa mga like condom sa para ma-prevent ang spread sa said disease. And since commonly nga makuha ni siya during sexual activity is need jud og protection all the time. Bisan bitaw ka ng kasado na, kung if kasado na mo is need mo like magpa-check up if ever nga mo kabalo nga imuhang partner di ay carrier na siya sa HIV or AIDS or other infectious disease. So need na dinhi nga ma-learn nato or ma-educate ta sa tamang buhaton. The next element is the Adolescent Reproductive Health or the ARH. Fertility awareness, human sexuality, and counseling are basic services which help promote responsible sexuality among adolescents. These are very critical among the young adult to understand reproductive health. So, fertility awareness, wherein tudluan ang mga binata and dalaga about sa mga pwede mahitabo or kanang mga may use og sex, in short, the sex education. So, since dili man, wala man ni gina-normalize or wala pa ni gi-add sa curriculum sa Philippines, but sa college is important nga, before pa ma-college bitaw is matudluan ang mga adolescent, mga teenager about ani since pinaka-common ang early pregnancy and morbidity tungod sa early pregnancy is nag-increase na ang morbidity and mortality rate. Kay dili man sila kabalo paunsa kay kanang aksidente nga naburos unsa ilang buhaton or kanang ganahan sila makipag-sex sa isa ka tawo pero wala sila kabalo sa pag-use sa protection and wala sila kabalo unsay mga risks or consequences after nila makipag-sex. Mao tong need ang sex education sa mga labi na sa mga teenager kay dinha jud sa ilahang sa ilahang age peak ang kaning ma-curious about aning reproductive or kanang mga sex activities. That's why important jud ang sex education, and as a health advocate or in student nurse, if naay mangutana about aning labi na kanang about sa sexual activity unsa ang kuan ang mga buhaton na dili man jud na maiwasan nga nay mangutana nimo, so itubag na lang pud nimo wherein dili mo ma-awkward, ayog katawa like ayog ka awkward pud, tubagon nimo siya in a truthful way kung unsa ang mga pwede mahitabo wherein pwede nakakanang dito isulod nimo ang health teaching kanang masabtan nila ang consequences ug mga dapat nila mahibal-an aning mga buhata para maiwasan ang katong mga early pregnancy o kanang makakuha sila early infectious disease like HIV and AIDS. The next on the list is the prevention and management of abortion and its complication. The major causes of maternal deaths are complications from unsafe abortion as consequences of unplanned pregnancy. Preventing unwanted pregnancy through family planning reduces maternal deaths. Proper management of complications includes medical treatment and family planning, counseling, and services. So, prevention sa abortion and complication. Mao to akong ginaingon, one of the major cause sa mga kaning abortion is the early pregnancy, wherein ang mga teenager is the kanang early na buros, then gitago-tago nila, then wa nila gipahibalo, then magpataka og inom og tambal og abortificants nga wala sila kabalo sa effects, then allergic or nada ay some reaction sa ilang nga nag-cause og complications sa ilang health. That's why need og counseling ang mga teenager, or biskan dili ang mga teenager, like mga kanang mga adult na nga gayus og abortion nga dili ni siya healthy, dili healthy gamiton kay dagkog effect og dagkog dagok sa ato ang health ang pag-use og abortificants. Then dinhi mosulod ang proper counseling, maong need biskan dili mo boros or wala pa family, need ninyo may balaning family planning kung unsa pag-control sa population or mga need buhaton if maburos ka, or mga need nimo iwasan kung di ka ganahan maburos. Mauning include sa elements ang prevention sa abortion para males ang complication sa isa ka mami og dili mas mo complicate iyang health in the future. Next one is prevention and management of breast and reproductive tract cancer and other gynecological condition. Breast and other reproductive tract cancers are major concerns in public health. The provision of family planning services provide an opportunity for screening and detection of breast and reproductive tract cancer. Moreover, combined and oral contraceptives are proven to reduce the risk of ovarian and endometrial cancers. Routine cancer screening offer clients opportunity to choose various family planning methods when further diagnostic workups have to be undertaken to establish diagnosis. So, kanipong prevention and management sa breast and reproductive tract cancer, wherein nga gikan sa unprotected sex or unprotected sexual activity is nag-cause na or mag-lead siya into cancer, like the breast cancer. Like sa atong mga bayi, important nga ma-educate ta sa mga bawal himuon or bawal i-take nga mga tambal nga pwede mag-cause og breast cancer. And also, like, di ba gi-recommend na sa mga doctor, like, not to wear tight clothes which can nga makaipit or dili makaginhawa imuhang breast. Maunang dili pod gina-recommend nga mag-wear tag bra, labi na if nara sa balay or kanang sa pagtulog bitaw, kay maipit imuhang breast, which is pwede maipit tong mga ugat sa sulod sa imuhang breast nga mag-lead or mag-cause into breast cancer. And dini po masulod ang reproductive tract cancer, wherein pwede ni siya kanang cause gikan sa pag-inom or patakag inom sa tambal, like pills, para lang maiwasan ang pagkaboros or something nga like pang pagwapa or ana nga wala bitaw wala gireseta gikan sa doktor. Mao nang dinha ni sulod sa family planning nga pod nga kaning elements is gi-include nila para ma-prevent ang further complication o para muubos ang number sa kaning makakuhag mga cancer tungod aning breast and reproductive tract infection. Next on the list is the education and counseling on sexuality and sexual health, means reproductive health or MRH, and involvement. Sexuality education is a basic component of family planning, wherein family planning, counseling, and providing correct information on sexuality will help reduce unwanted pregnancy. Dinhi balik musulod siya ang sex education. Maong important jud ni na sana ma-apil ni sa curriculum, wherein dinhi kasi education and counseling and sexuality dinhi labi na sa adolescent nga time is daghan na ma-curious about sa ilahang sexuality, kung unsa ba ni siya, like wala sila kabalo like magkuan sila nga wala sila in between sa kanang woman and man ilang sexuality. Mao nang ma-curious sila unsa ni siya, unsa ko, laki ba ko, bayi ba ko, laki ko pero mura magbayi akong kuan, akong feeling. And sexual health means reproductive health. And mga ignorance kung unsa na ilahang reproductive health nga wa sila nakabalo nga maghimo sila sexual activity not knowing unsa ilahang sexuality basta tungod lang sa kanang adrenaline rush sa ilang desire. Thus dinhi musulod ang mga unwanted pregnancy. Maong important appeal ni siya sa elements sa kaning reproductive health para ma-lessen or ma-reduce ang number sa unwanted pregnancy. The next on the list is the violence against women and children. Domestic violence mostly occur in women and children. It is recognized now as important social and public issue. One of the most common forms is sexual violence. This provides an opportunity to discuss and promotes family planning. So, dinhi violence against women and children. Pinaka-common ni domestic violence, labi na if most common cases is if naibisyo ang kanang male partner sa woman, mauna mahitabo ang mga domestic violence wherein dili lang ang mama ang maapil pati ang child bitaw is pagbuntunan niya sa iyang kuan sa iyang galit o mabunog pod niya. Maunang karon okay na ron since na may law nga mo cover aning violence about sa woman and children. Nag-recognize po ni siya as important social and public health issue since ma-involve man god ang mama o ang bata ani. And one of the common forms ni siya sa sexual violence wherein kanang like dili ganahan ang woman nga makipag-sex sa iyahang partner pero ginapilit siya, then syempre mo kuan ang bayi dinhi mosulod ang sexual violence wherein mupilit kanang bunugon na ang iyahang woman partner para lang masunod iyahang gusto. Maunang kuan pod dinhi pod mahitabo usahay ang mga unwanted pregnancy wherein kanang bag-o pa nanganak ang woman, then baby pa jud ang iyang kuan, ang ilahang anak, then since ang laki is mupilit man siya makipag sexual activity sa bayi wherein dili pod ganahan si mommy kay bag-o palagi dili pa pod naghil iyang mga kalawasan pero since mapilit og naay kanang violence giyusan og violence sa laki maong nahitabo nga maburos na pod ang bayi biskan dili niya gusto pa. This provides an opportunity to discuss and promotes family planning. Manang dinhi na maapil siya sa family planning para maiwasan pud ni siya nga mga panghitabo. Last in the list is the prevention and management of infertility and sexual dysfunction. So dinhi is gina-prevent ang management sa infertility and sexual dysfunction wherein kanang nay mali sa about sa sexuality where kung naay sexual activity is dili magawsan ang male partner or ang kanang female partner. Dinhi naay program kung paunsa ma-manage or unsa ang mga intervention nga himuon or paunsa na siya ma-heal or pwede ma-resolve ng infertility or ang dysfunction. Mao nang nasila program og health teaching nga mahitabo unsa ang pwede angay buhaton sa bayi para makuan ang ihang infertility as a woman or ug mutaas ang number sa iyang eggs nga pwede ma-produce during sex and sa laki pod kung paunsa siya magawsan. Giapil pod ni siya sa family planning kay itulo man didto ang mga ways unsa mga pwede angay buhaton during the sexual activity para ma-prevent ug ma-manage ning dysfunction og infertility. In the next slide, we can see the framework of reproductive health. So the concept of this reproductive health in a circular presentation represent the holistic approach of all health efforts, and include na din ang 10 elements nga gi-mention nako, which are reflected in two outermost circle in the framework. Because of technical readiness and availability of resources, the DOH has focused in addressing the health concerns on the first four priority elements of the reproductive health, namely family planning, mao ng FP din ha, the maternal and child health and nutrition, the CHN, prevention and management of reproductive tract infection, including the sexually transmitted infections, STIs, and HIV or AIDS, then the adolescent reproductive health, which or the ARH there. As you can see sa drawing, the other 6 elements are at the different stages naman of development, from policies and framework formulation to pilot implementation and selected facilities and areas. So the two innermost nga makita ninyo circles embody the core principles and key features that the 10 elements should be built to ensure solid, responsive, and pinaka-effective health program directions and outcome for us Filipinos. At the core, kay since gold man dapat na iyang color, pero since Xerox man ang nasa libro, the innermost circle nga makitaan ninyo are gender responsive, culturally oriented, and rights-based approaches. The general guiding principles that govern and design in the implementation of all reproductive health elements and other health-related programs and activities. Dinhi mabilong ang rights-based recognizes reproductive as a critical part of human rights. Culture-based recognizes the variation in health-seeking behavior, service care preferences, and quality perception of clients, requiring responsive approaches in health service delivery. And the gender responsive entails recognizing the differences in how women and men behave and act. While sa second innermost circle, which is green dapat na yung color, represent the four convergence thrusts forwards health reforms that must be collectively addressed to attain better health outcomes, a more responsive health system, and equitable financing for health. These include ang health financing, which intends to secure greater and better sustained investment in health, then ang regulation that ensures access to quality and affordable health goods and services. And the third one, ang health service delivery nga nag-ensure og accessibility and availability sa basic and essential health care. Then the next is the good governance in health that will improve the performance of the health system. So as based sa drawing no, makitaan ninyo nga naa sa pinakasulod jud ang gender culture right-based approach, then naa na din ha ang financing, integrated service delivery, regulation, good governance. Then musunod na din ha ang MCHN, the family planning, STI, HIV, AIDS, the ARH, adolescent, nga gikuan nako kaganiha. Then naa din ha sa musunod ang rep cancer, PMAC, sexuality, and fertility, and the men's RH. Then nay araw nga nagkatudlo public and private sector, since na sakop man na niya nga mga program, which is dapat matudlo or gikan sa community. Nga motudlo siya padulong sa access to RH services and information, MMRH, IMRH, that will lead to better quality life. Muna ang framework sa reproductive health in the Philippines. I hope nga na-understand ninyo tong 10 elements sa reproductive health and how the framework works and what is the reproductive health in the Philippines. That would end our report. I hope nga naka-understand mong tanan. That would be all. Thank you.